sepsis is something that we have a lot of interest in for capturing. And again, what sepsis is this type of massive infection that's caused by an infectious organism and then causes the body's immune response to react. As a result, the immune system releases all these chemicals in the bloodstream to fight the infection, and it's this widespread systematic inflammatory response. Due to this widespread inflammatory response, blood flow can be impacted, and then we can have multi-organ damage and ultimately multi-organ failure. Sepsis doesn't occur without a reason. So for our purposes, think of it this way. We don't have sepsis without some sort of infection. Severe sepsis is an infection associated with some sort of organ dysfunction. So sometimes you'll see the term systemic inflammatory response syndrome. This is what we're talking about. So with this type of severe sepsis, we're talking about one or more body organs failing, liver, kidneys, what have you. Septic shock happens when the body's blood pressure drops, and then the patient starts to go into heart failure. So with septic shock, the patient is going into shock as a result of the sepsis. And typically what happens in short order is we have low blood pressure, lung failure, heart failure, kidneys, liver. With severe sepsis, we require at least 2 codes at minimum. We first code the underlying infections. So this could be something either from A40 or A41, or in the case of OB or postpartum or post-procedural sepsis, there's certain codes for that. Then the second code would be something from the subcategory R65.2, severe sepsis. Severe sepsis may either have 0.20 or 0.21 for with and without septic shock. So R65 and R65.20 and R65.21 for severe sepsis. There's notes in the book that tell us that these codes cannot be listed as a principal, first listed, or the only codes. So in other words, when you're encoding a hospitalization and the provider will document severe sepsis, septic shock, you can never have these R65s as the principal diagnosis. We would code the underlying infection. In other words, the code from A40 or A41. When severe sepsis is present on admission and meets the definition of the principal diagnosis, in other words, the reason after study that the patient was admitted, the underlying systemic infection is assigned as a principal. Then we would have the R65.2 code. When the patient's admitted for treatment of sepsis and the severe sepsis develops after they're hospitalized, in other words, during the hospital stay, the underlying systemic infection is going to be coded first. And then, of course, the present on admission indicator of no would be reported, because the severe sepsis developed after the patient was admitted. If a patient's admitted to the hospital with an infection in a particular body system, such as pneumonia, and then it escalates to sepsis or severe sepsis, that code for that systemic infection is coded first. This could be an A40 or A41. Then we would assign the code for the localized infection, in other words, the pneumonia. And then if severe sepsis is present, then we would use one of the R65.2 codes. If a patient's admitted to the hospital for treatment of pneumonia or another localized infection, and the patient's condition worsens to the point where they have sepsis or severe sepsis, again, the R65.2 code will never come first. It has to be the localized infection. Note in terms of OB and post-procedural infections, post-procedural sepsis, those are other codes. In terms of HIV, human immunodeficiency virus disease, HIV disease can lead to the acquired immune deficiency syndrome, otherwise known as AIDS. The HIV virus and the HIV-1 virus are basically the same thing. This is what we're talking about. And what this virus does is wreak havoc on the immune system by destroying the CD4 and T cells that are used to help fight infection. These human T cells come under attack by the HIV virus, and without enough T cells, the body immune response fails, and then the patient is prone to these opportunistic types of infections. Anyone with fewer than 200 T cells or percentage of less than 14 is considered to have AIDS. AIDS is the late stage of an HIV infection. When we look at HIV classification, we need to look at several things. First of all, the human immunodeficiency virus, or the HIV disease. This includes AIDS, AIDS-related complex known as ARC, or any symptomatic HIV disease. If somebody is positive for the HIV virus and they have no symptoms, the code that's used is the Z21. Asymptomatic human immunodeficiency virus. So in other words, they don't have any evidence of active HIV disease, AIDS, AIDS-related complex. They just are positive, but they have no symptoms whatsoever. If they're inconclusive, in other words, they've had the test, but they can't, it's inconclusive about whether they do or do not have AIDS or the HIV virus, then it's a signs and symptom codes of R75, inconclusive HIV test finding. We only code confirmed cases of HIV infection or AIDS. Terms like suspected, possible, or any uncertain terms are not coded per the guidelines for this chapter. If these terms are used, the physician needs to be queried to clarify whether they do have the disease or not. In other words, do they have symptoms of the disease? Is it inconclusive? What have you? And again, that relates back to the previous slide here. These are all mutually exclusive. B20, they're positive with symptoms of the disease with B20. Z21, they're positive for the virus, but they have no symptoms. And then R75, it's inconclusive. It's one of these three. It can't be more than one of these three. HIV-related illness requires at least two codes. The B20 will be first to identify the HIV disease, and then it will say in the tabular to use additional codes for any related illness. Here's some examples. So again, you can see here what we're talking about with B20. B20 will always be the first code. And then following that, we would use an additional code for any manifestations of the disease. For the most part, any time we have a condition that arises in a pregnancy, childbirth, or postpartum, it usually is going to direct us to the OB chapter. In other words, codes that would start with an O. So in this case, with HIV related illness in pregnancy, childbirth, or postpartum, the first code would be O98.7. We would still use additional codes to identify the type of HIV disease. This is discussed in guideline 1.C.1.A.2.G. When a patient with HIV disease is admitted for an unrelated condition, such as a traumatic injury or something that has no relation to the HIV diagnosis, the first code would be the unrelated condition. And then consistent with the general guidelines, we would still code the B20 as, even though it's not the reason that the patient was admitted, it still affects the care and management of the patient. So we'd code the B20 followed by any additional diagnosis codes for any reportable HIV related condition. That's all I have for you. We'll see you in line to discuss more of infectious disease guidelines and coding. Bye now.